Okay. Thank you, Mr. Chairman. Mr. Crone, can you give me again the percentage of Medicaid patients that you think, or that has been estimated, will that be added to the rolls in Arkansas?
We think that between 165 and 185,000 new Medicaid enrollees could come in 2014.
Okay. That being the case, how are we going to pay for that?
Now, the good news for that, for the state, is that it's 100% federally funded in 2014, 15, 16, 95% federal in 17, 94, 93, and in 2020 and forward, it's $9 federal for $1 state. We're now at 7.3.
Well, Mr. Crone, you're talking about the federal government that's bankrupt.
Yeah.
I mean, how are we going to pay for this? Yes, Mr. Bradford.
Obama bucks.
It's an excellent question. It's on everybody's mind. We know we have a Medicaid shortfall in what we have on the books now.
Excellent question.
If it stays intact, it's going to be the same for the federal exchange or the state exchange. That criteria there, we don't have any control over. And so the debate is a good debate, certainly about the cost, of course, but that is in the federal act. You know, those percentages of participation is in the federal act. So if we don't do anything, and you all don't want to go forward with the partnership, that issue is still going to be red hot and alive.
I understand that, Commissioner. Can I ask, I assume both of you have read the Affordable Care Act.
I read it 2,600 pages.
So neither one of you have read the entire bill?
I've read the part that has to do with exchanges.
So you have not read the entire bill?
Pages. Yes.
I have read the entire bill, believe it or not. It took me a long time.
That was a big
I also spent some time talking with some physicians in my area who said that if this bill passes, they would no longer take Medicaid patients. So what we have here is a lot of people who are going to be spending 6, 8, 10, 12 hours or longer in an emergency room with a fractured arm because they cannot go and see a physician who are on Medicaid. By the way, if someone is declared eligible in Arkansas to be on this program, who has the statutory authority to declare them uneligible?
To declare them uneligible?
Yeah, can they be declared uneligible?
Yes. In fact, that's one of the responsibilities of the exchange, to determine who, one, is exempt from eligibility.
Is that the state or the federal government?
We have a federal exchange in Arkansas now.
Right, I understand that, but are you saying that the states have no control to declare someone ineligible?
The states would have some control if they had a state exchange.
They have
but
no.
we do not do eligibility.
They have no control, ma'am. There's a clause called maintenance of effort clause that says the state has no power to declare someone ineligible once they've been declared eligible. You cannot remove them from the roll.
Well,
You're talking about Medicaid?
Talking about the Affordable Care Act.
you got the answer? Good.
Well, there's a maintenance of effort for Medicaid. And it also says at some place, and it may be in your regulations or interpretations, that if a state has a predicted deficit in their Medicaid program, that maintenance of effort can be lifted for the people between 138% and their current eligibility. So that while we now cover children to 200%, or pregnant women, family planning, other reproductive health services, it would be a way that Medicaid would be able to have a less maintenance of effort and go back down to the modified adjusted gross income. But the individual should be covered because of the exchange plan and the private insurance plan. So you have an individual family member covered, but but you have less Medicaid maintenance of effort, if that answered your question, but there is a provision for that.
Well,